Hi, I'm Pratik, and in this video we're going to be looking at the Dental Core Training National Recruitment Process updated for 2025. Remember, if you want access to thorough revision notes, exam cheat sheets, CPD, along with a huge bank of exam style questions and guidelines, then head over to examendental.com. You can also find one-to-one mentoring sessions there to help you ace your exams and interviews. So Dental Core Training refers to post-foundation dentistry training that can be carried out in the UK. It's an optional up to 3 years of training that you can carry out, and this can be done in a variety of specialties. The most common reason people do Dental Core Training is to increase their exposure to different specialties. It is a national recruitment process, therefore it is a competitive process. That's why it's so important that you pay attention in this video and you try to use some of the resources to maximise your chances of getting a Dental Core Training job. I've previously done a video on the Examen Dental YouTube channel about Dental Core Training during the COVID pandemic. However, the application process has changed slightly, and so I thought it was important to do a new video to bring you up to date on those changes. You can also check the Examen Dental YouTube channel for some of the older videos on the Dental Core Training application system. These may well still help you as part of the process. So there are 4 key points in the Dental Core Training application process. The first is the online application. The second is the situational judgment test. The third is a virtual interview, and the fourth is preferencing or ranking of jobs. It's important to say that we at Examen Dental have no affiliation with Health Education England. They are the body that you need to be keeping up to date with in relation to everything related to the national recruitment process. The website link is in the description below. Make sure to head over there and keep checking their website to ensure there are no changes to the process. Currently, based on the Health Education England website, this is the recruitment timeline. It's important that you keep checking to ensure that none of these dates change through the process. I have mentioned that this is a competitive process. This gives you an idea of the number of jobs that are currently available for Dental Core Training versus the number of applicants a few years ago. It is quite difficult, particularly for temporary registrants, because there are fewer jobs available for these individuals. It's also important to note that for Dental Core Training Year 1, there are often a lot of applicants, but as the process progresses, this applicant number usually drops, as a lot of people apply for Dental Core Training just to keep their options open, and then as they get associate jobs, they withdraw their applications. So the first step of the application process is the online application, done on the Oriel website. Some of you may be familiar with this website from Foundation Dentistry or even Dental Core Training. The Oriel website is where all the communication will come through with regards to your application, including invites for SJTs and invites for interviews. So it's very important that the email you have linked with your Oriel account is regularly checked, and none of the Oriel emails are going into your junk or spam folders. So go onto the Oriel website, you find the Dental Core Training job advert, and you start the application. Don't leave it to the last minute because there is quite a lot to fill in and you don't want to be stressed right at the end. The application is also the first way that candidates will be long listed in the application process. If there's anything wrong with the application, then Health Education England will remove people at this point. So if you have any doubts about information that you're putting on the application, contact Health Education England and they'll hopefully be able to provide you with some guidance. Once your application goes in, you will then eventually, if you're long listed, be invited for the situational judgment test. The SJTs aren't an assessment of your clinical knowledge. They're more an assessment of your professionalism, your ethical behaviours, your morals. They'll often be looking at things like how you manage stress, how you timekeep. So historically, the SJTs used to be done on the same day as interviews, but over the last few years, they've been separated, and you now go and do your SJTs at one of those computer banks, similar to your driving theory test, where you go, lots of computers around, and you sit your exam there. We have got another video on the Examen Dental YouTube channel that talks you through the SJTs and the types of questions, along with some key tips on how to prepare. But overall, there are 2 key types of questions on an SJT. The first is where you have to rank your options from most appropriate to least appropriate, and the second is where you choose the 3 most appropriate options for a particular scenario based on the options you are given. Once you've done your SJT, you will then receive a mark from this. You won't see this initially, you will see it at the end of the application process. It is really important that you practice for your SJTs, and there are some key resources along with those that we provide at Examen Dental that I've linked in the description below. One of those key resources is the Situational Judgment Tests for Dentistry book. This is one of the only books available specifically for dentistry to help you through the SJTs. As I've already said, you need to keep checking your emails because booking for your SJT and your virtual interview is done on a first come first served basis. So if you know there is a certain location, a certain date and a certain time that you can only do, then you need to make sure you get on there as soon as the booking window opens so you can get the exact appointment that you want. Another reason that it's important to do well in your SJTs is that Health Education England have an SJT cutoff. So you need to score a minimum number of marks in order to progress onto the virtual interview. If you progress onto the virtual interview, this is done through the CUPACOM system. Now some of you may be familiar with the CUPACOM system from FD or DCT. It's a very structured interview system where every point of your interview is timed to the second. The way it works is you have two interview stations. You have one, which is a clinical scenario, and this is where you can flaunt your clinical knowledge. So it's where you speak to the interviewers dentist to dentist. So you can bring all your guidelines, all the other clinical jargon that you know. The other station is a clinical governance, professionalism, management and leadership station. So this is where you talk about things like the 7 pillars of clinical governance, your ethical scenarios, things like Mental Capacity Act. And for each station, you get asked 3 questions on the scenario that you've been given. Usually, I find that people struggle with the clinical governance station more because they aren't as familiar with these topics and themes. Again, we have some other videos on the Examendental channel to help you prepare for this. The way the timings work is initially you go into a holding room. This is where your ID is checked and your room is checked as well to ensure that no one else is there with you. You then go into your reading time, so you have 3 minutes to read the first scenario. You can't write anything down during this time and you'll be being observed, so it's important you don't show any signs of cheating. You then move into your interview station, which is 8 minutes long, and you get asked your 3 questions. If you finish earlier before the 8 minutes, you can choose to leave the room or you can sit there in silence. If you take the full 8 minutes, the second 8 minutes is hit, you'll automatically be moved out of the room. So there isn't really the opportunity for any niceties like hi and bye during the interview. You then go into your next reading station and then your interview station, and you finally exit the interview. It's very important you test the Cubicon system on the device that you're going to use for your interview to ensure it's compatible. Also check your internet connection for wherever you're going to be sat for your virtual interview. Practice is really important. The more you practice, the more confident you'll be for your interview process. And this is where we help a lot of candidates through our one-to-one sessions on Examendental. We provide bespoke mentoring to help guide you through this slightly difficult interview process. Another reason the interview process is difficult is because before virtual interviews were introduced, there used to be a third station, a communication station, where you would talk to a patient face-to-face. However, now with the virtual interview system, they've removed this station, and instead, your communication skills are being assessed through these 2 remaining stations. That means your communication skills need to be good for these stations, and a lot of people forget this. We help you at Examendental to master those communication skills for your virtual interviews. If you don't want to practice with us, practice with your colleagues, practice on your own. Just make sure you practice to try and ace these interviews as best as possible. The next step beyond this is your preferencing and your job offers. So your preferencing window opens just before your interviews happen and closes just after. And during this time, you will go through the jobs that are available and rank them from the one that you're most happy doing to the one that you're still happy to do, but not as happy doing. There's a really good document on the Health Education England website that goes through all the posts that are available, and it tells you what specialties involved, are there on calls, are they days, nights, weekends, is it suitable for temporary registrants, for example. It also contains contact details so you can speak to someone in that department. It's useful to start looking through this document even from now to ensure you're familiar with the jobs that are available. And you will essentially go through these jobs and you'll preference the ones you're happy doing. Obviously, if you're not happy doing a job, for example, you don't want to relocate to a certain location, then don't preference that job. There's no benefit to doing that. However, I'd still recommend to preference a good selection of jobs to give you the best chances of actually getting one. Once you've gone through this process, you've done your SJTs and you've done your interviews, you will then ideally be given a rank. The rank is made up of your scores from your SJT, from your 2 interview stations, so a third from each of these, and this will then give you an overall score. That score will then produce a rank, and you will be ranked against all the other individuals who have done the Dental Core Training National Recruitment process. And you'll get a rank all the way from 1 to however many people have applied that year. This is why it's so important you do well in each of your steps, because the higher you rank, the better your chances on getting your first choice job. It's also important to note that you have to score at least 30% in each of the components to be considered for ranking. And there is also a system called red flagging. This is where, if a candidate has done something particularly outrageous or something that should not be considered to be professional enough to be appointed, Health Education England can take you out of the recruitment process completely. Ideally, you will get a rank and then you'll be offered a job. You then have a few options of what you do with that job offer. So the first option is you could choose to withdraw, and actually you can withdraw from any point from when you submit your application. This basically takes you out of the application process. You won't be invited for anything else and you won't get any job offers. So you can choose to decline a job. This is where you get offered a job, but you don't want to do that. So you decline it, you won't get offered any further jobs, and you'll be taken out of recruitment. You can also accept a job. So if you just accept a job, say it is your 10th choice job, you're saying you are happy doing that one job. You won't get offered anything else, and you will be ending up with that job at the end of the recruitment process. The alternative is you could do an accept with upgrades. So this means that if you get your 10th choice job, you accept that you're happy doing that, but if any of the jobs that you ranked higher suddenly become available because someone's declined or withdrawn or whatever it may be, you're happy to be automatically upgraded to that job. The process is automatic, so you won't get a say in it and you can't backtrack if you do get upgraded. There's also the option to hold a job offer and hold with upgrades. So as the name suggests, with holding a job, you're holding it for a few days, maybe while you make a decision if you want to do it. The process of upgrades is the same as accepting. We have done another video on the Examine Dental YouTube channel on the pros and cons of doing dental core training. At Examine Dental, we're big advocates for doing DCT because we think it's extremely beneficial for career progression. However, there are some disadvantages to doing it, and so it's important that you go and have a look at this video and you consider the options for you as an individual. Of course, at Examine Dental, we have lots of resources for you to help ace the interview process and the entire application process. So have a look at our other videos or head over to Examine Dental to have a look at some of the resources on there. So in this video, we've looked at the application process on the Oriel system, we've looked at the situational judgment test, we've looked at the virtual interview system and what this involves, and we've looked at preferencing of your jobs. If you are applying for dental core training, good luck. If you do have any further questions, then please contact us at Examine Dental. Contact details are below. If you found this video useful, please like, comment and subscribe. And until the next video, take care.